Hi again, everyone, and thank you for joining me today. And I appreciate you taking the time out of your busy schedules. Today, I will be talking about stroke prevention and cardiovascular health. But before we start, I just want to introduce myself first. All right, so my name is Karina Sherman, and I'm a nurse practitioner. I've been a healthcare provider for over 15 years, working in a variety of settings. I chose the direction of nursing because, unfortunately, I've been in and out of hospitals with my mother since the age of 13, and I had to learn early on that it's crucial to be able to advocate for oneself and for your family members to be able to survive our current medical system. I was always interested in holistic and natural health, and this is what has drawn me to pursue my path in functional medicine. I am passionate about preventative and individualized healthcare, and I really like to work with clients to find the root cause of their symptoms rather than just simply patching the symptoms with a band-aid. Okay, so today we will cover the basics of what a stroke is, being able to recognize the signs and symptoms of stroke. We will review a few facts and recent research findings. I'll talk a little more in detail about dementia risk. We'll cover risk factors and what you can do to reduce your risk of a stroke and what investigations may be helpful. And we'll end with a Q&A session at the end. So if you have any questions, please leave them to the end of the presentation. Okay, so there are two main types of strokes. One is an ischemic stroke, which occurs when a blood clot blocks the blood flow in an artery within the brain. And the other one is hemorrhagic. This one occurs when a blood vessel bursts within the brain. But about 87% of all strokes are ischemic in nature, and that's what we'll focus on today. Okay, so how can you recognize a stroke? Most signs and symptoms include sudden onset of weakness or numbness to one side of your body. So it can be your face, arm, leg, or if you develop a facial droop. So if you smile, you look in the mirror, your face is not symmetrical, or any speech difficulties. So things like slurred speech, trouble finding words. Some other less common symptoms may include things like double vision or sudden loss of vision in one or both eyes, or ataxia. People with ataxia lose muscle control in their arms and legs, and this may lead to lack of balance, lack of coordination, or trouble walking. So if you or anyone else does experience these symptoms, even if they're brief, it's always better to call 911 rather than drive to the ER. And that's because the EMS personnel are trained to be able to bypass your local hospital and take you to a specialized hospital that specializes in stroke care. Not every hospital specializes in stroke care. And yeah, so they can provide you with the appropriate treatment essentially. And the faster you get to the hospital, the better, because time is very crucial. The time window for certain treatments has been extended to 4.5 hours since your symptoms onset, but it is even more effective if you get treatment within 90 minutes. So this slide just reviews a few statistics. There's a new study that was funded by the Heart and Stroke, which revealed that annual stroke occurrence rates are roughly 1 every 5 minutes. Another recent study showed a 157% increased risk of ischemic stroke in women who experienced either natural or surgical menopause before the age of 42. So estrogen has been found to be protective for stroke in women younger than 50. Several other studies showed that hormone replacement therapy initiated in women under the age of 60 years old and or within 10 years since menopause significantly reduced all-cause mortality and cardiovascular disease. Another benefit is that hormone replacement therapy can help reduce the onset of diabetes and insulin resistance in women. Recurrent strokes occur in about 1 in 4 people who have had a stroke within 5 years after the first stroke, and the risk is greatest right after the stroke, and it does decrease over time. Usually the risk is greatest within the first 4 weeks after having a stroke. So stroke happens when blood flow to your brain is interrupted and cells are damaged or die as a result. And this damage can lead to dementia. So actually, shockingly, having a stroke more than doubles your risk of developing dementia. So clinical strokes are actually a medical emergency, and they are recognized by the fast signs and symptoms that we discussed earlier. But some strokes aren't so obvious. So covert strokes have no physical signs or symptoms. And then dementia symptoms may start. Covert strokes occur 5 times as often as more obvious or clinical strokes. Covert strokes are responsible for at least 1/3 of all dementia. And these covert strokes they weaken connections among various parts of your brain and affect executive function. So it's essentially executive function is a set of mental processes that help you get things done. So these include things like planning, organizing, processing information, multitasking, problem solving, decision making, reasoning, and finding your way around. So essentially, these covert strokes can lead to something that's called vascular cognitive impairment, or VCI for short, which is a disorder of the mind, and the most serious form of VCI is called vascular dementia. Vascular dementia can cause difficulty doing even basic things like getting dressed or bathing. The most significant symptom of vascular dementia tend to involve speed of thinking and problem solving rather than memory loss. And so the heart and the brain are connected by the vascular system. The vascular system is a network of blood vessels that carry blood, oxygen, and nutrients throughout your body. And vascular cognitive impairment, or VCI, may be caused by vessel wall disease or tiny clots that block small vessels in the brain, resulting in a lack of oxygen and damage to the brain cells. Your risk of developing VCI increases if you have a history of heart disease or stroke. Heart, brain, and mind conditions share many of the same risk factors. So reducing your risk of stroke essentially also protects your brain. Covers the risk factors. I won't be going through all of them today, but the primary driver of cardiovascular disease in most people is inflammation. And one of the most common causes of that inflammation is elevated blood sugar. And this is why those with insulin resistance or its progression to type 2 diabetes are many times more likely to develop cardiovascular disease than those without. Elevated blood sugar inflames arteries, and the immune system tries to respond to protect and repair the arterial lining. It is then this out-of-control immune response that leads to progressive buildup of cholesterol and other things that can eventually block an artery and cause a heart attack or stroke. High blood pressure is another risk factor. High blood pressure strains blood vessels, making them harder and more narrow, and a blockage is more likely to occur, causing an ischemic stroke. It can also weaken the blood vessel and put them at more risk to burst, causing a bleeding stroke or hemorrhagic stroke. Smoking, as you already know, smoking does have many harmful effects. Some of them include increased risk of clot formation. It can also reduce the amount of oxygen in the blood and cause the heart to beat faster, increasing your blood pressure and increasing the risk of atrial fibrillation. Atrial fibrillation is another risk factor, and it is essentially an irregular heart rhythm. It can cause blood clots to break loose and cause a stroke. Another risk factor is lack of exercise. Getting exercise is very important. So if you're able to get in some exercise at work or during your free time, it will decrease your risk of having a stroke from anywhere between 15% to almost 50%. So try to get at least 30 minutes of exercise each day, and it doesn't have to be all at once. So try to, for example, take the stairs instead of the elevator. When you can, try to park your car further. Even a short walk around your neighborhood will help reduce your risk. Sleep apnea is another risk factor. Sleep apnea occurs when there are periods when breathing stops or becomes shallow during sleep and is diagnosed by a sleep specialist through a sleep study. A healthy, balanced diet is also important. The current recommendation is to follow a Mediterranean type or DASH diet, which is high in vegetables, fruit, whole grains, fish, nuts, and healthy fats. It is recommended to consume a variety of natural whole and minimally processed foods at each meal. And of course, stress reduction is extremely important. Finding something that works for you, whether it is taking a walk in nature, taking time for self-care, downloading a meditation or breathing exercise app, whatever you can get into your daily routine, even if you just start with 5 minutes per day. Okay, and the last slide here talks about some recommended investigations. I personally like to include a comprehensive blood work, which includes things like not only your cholesterol levels, but also to test the size of your cholesterol particles, your sugar levels, your vitamin D, homocysteine, among other things. Homocysteine is an amino acid. And it's interesting to note that too much homocysteine in the blood can trigger potentially artery clogging inflammatory reaction along the artery lining. Yet conventional physicians don't routinely check it. High levels of homocysteine may mean that you have vitamin deficiency, like B6, B12, and folate. And without treatment, it can increase your risk of dementia, heart disease, and stroke. Similarly, vitamin D deficiency is also a risk factor for stroke and is associated with increased severity and poor prognosis following a stroke. And some other investigations, depending again on your risk factors, that we can do is head imaging like CT or head MRI. We can do some vascular imaging. So this is to check for any blockages in the arteries of your head or neck. And then we can do some heart tests. So for example, an ultrasound of your heart to make sure there's no structural abnormalities, and a Holter monitor to make sure there's no irregular heart rhythm, such as atrial fibrillation, and a sleep study test to help rule out any sleep apnea. So that's pretty much concludes the presentation. I just wanted to leave enough time. If you guys have any questions, you can put them here in the chat, or you can ask directly.